powerful new treatment is on the horizon after they've discovered how to make huge quantities of cells which produce insulin. Let's talk to Professor Anthony Hollander, who's a stem cell biologist at the University of Liverpool and can explain more. Thank you very much for joining us. So, how exactly would this work?
Good morning, Naga. Well, the idea here is to generate very large numbers of insulin-producing cells from stem cells, these kind of blank slate cells, and produce enough to implant in the patient, not necessarily in the pancreas, which is where the natural cells are, but somewhere where the insulin can get into the blood and where the cells can detect the amount of sugar that's in the blood and respond to that.
And so that would eliminate completely the need to inject insulin for type 1 diabetes sufferers?
Well, that's the hope. Of course, we're still quite a long way from that. This discovery shows us how to take stem cells and make them function as if they were insulin-producing cells, and that's a great advance. We still have a long way to go to get to the point where we can try them out in patients and really prove that you can avoid insulin altogether. But that's the hope.
So currently the research is being done on animals, that's correct, is it?
That's right, in the lab and in animals.
And how long then generally will it take for that to be transferred to humans, for those tests to be able to be made on humans?
Well, that's the $6 million question, and the usual answer is about 10 years. Hopefully we can accelerate things, and the lab in America that's done this work will be pushing very hard to move things into patients as quickly as possible. But these things take time.
And just one more, if this does eventually, however many years it takes, when the cells are transplanted, could you paint a picture or just explain physically what that looks like? How many cells? What's the quantity? And you said it would be in a part of the body. So, any specific part of the body would be most productive?
Well, for example, they may be implanted into the liver, which sounds a bit strange, but there's a big blood supply to the liver. The cells may take there and detect sugar in the blood. In terms of numbers of cells, that's really got to be worked out. That's a lot of work that needs to be done. Probably some millions, but we don't know exactly.
Okay, thank you so much for explaining that for us, Professor Anthony Hollander. There's still some way to go, of course, but a breakthrough nevertheless. Thank you.
Absolutely. Thank you.
It's a